Hello, this is Dr. Stanley Lang. Welcome to this broadcast. The topic is on chronic stress and addiction. And the reason I wanted to share about this today was because of two different patients that I saw who were dealing with two different kinds of addiction. One is a medicine addiction and one was a food addiction. And I wanted to talk to you about my experiences with the role of chronic stress in causing addiction, because if we don't understand what's causing us to be craving something, it's much harder to resist the craving. If we know where it's coming from, or at least what's pushing it, if we know what's pushing the button, we can do something about it. So chronic stress is something that I've talked about a lot in a lot of different settings, but to briefly describe stress, it's the difference between where we want to be and where we are. If the distance is big, then the stress is big. If the distance is small, the stress obviously is small. And it's chronic if it's there all the time. If I can't make that budge too much between where I'm at and where I want to be, and in particular where I'm at has any kind of significant pain associated with it, then I'm very susceptible to addiction. I will find something to relieve my pain. That is sort of the human nature. That's our human nature. We do it subconsciously. And once we've found something to relieve the pain, we'll keep going back to the well to relieve the pain. Now, the pain might be emotional. It might be physical. It might even be a spiritual pain that we have very difficult time putting our hands on because it's so deep down in our psyche, we don't really know. But the point is that if we want to properly deal with whatever we're addicted to, whether it's food or a bunch of different foods, improper lifestyle, medication use, things like that, improper or illicit medication use or illegal drugs, then if we don't deal with the chronic stress in our life, we're very unlikely to overcome the addiction. So the stress can be overcome by focusing on the three major areas of our person: the body, the mind, and the spirit. In each one of these spheres, we have resources that allow us to overcome the stress, to help deal with the stress, to decrease the intensity of the negative feelings associated with that stressful circumstance. And the more that we focus on all three of these areas, body, mind, and spirit, the more likely we are to overcome the addiction. So just one example in each one of these three areas. In physical stress, one place that we have a lot of physical stress is our GI tract being out of good order. And if there's significant imbalance in the GI tract as far as the bacteria that are supposed to be there, chemicals that aren't supposed to be there, that increases our stress. Even without us feeling more stressful, it pushes the brain into a chronic stress chemical reaction, and it will aggravate anything else that's going on that's stressful in our life. So simply by starting to correct the GI tract, we'll start to have less stress in our life. And then if we looked at the emotional part of our life, simply looking at relationships, the most key relationships in our life, looking at the most key ones, just pick one and say, what can I do every day to make this relationship better, to make it healthier? The third area, spiritual, who do I need to forgive? And focus on that one area of working on forgiveness on a daily basis. So this is an example of what a holistic or whole person health approach to chronic stress reduction looks like. And it's something that we need to be working on if we want to overcome things that we have cravings for or actual addictions for. So I encourage you to approach your cravings, and if you have addictions in this whole person health approach. I wish you well, God bless, and have a great day.